you. We are here today just as public awareness to educate the public on coronavirus disease, COVID-19, as well as to inform people about preparedness of Aga Khan University Hospital, Nairobi. So what we have done as an institution is we've set up a coronavirus or COVID-19 Aga Khan University Hospital response team. It has three levels of governance. The first level is our senior leadership, of which all of us belong to. This unit is headed by the CEO, and the purpose of this unit is for release of resources and to communicate to our board of trustees and our executive. The next level, which I head, is technical committee. This sits and discusses the actual implementation. As the information comes in, as knowledge changes, then we adjust appropriately. Then the third level is the implementation level. In this way, we are implementing it right down to the ground. So the first stage which we have done is to educate our staff. That's one of the biggest weapons is education, education, education. In educating our staff, we have identified 6 experts within ourselves who then are educating one staff from each department. Then this staff from each department will educate their peers. In that way, every single staff at Aga Khan would be educated on the coronavirus, not just in knowledge, but also on what to do should a patient come in. Then we are also vaccinating our staff on influenza vaccine, and the purpose of this is not to treat coronavirus, but to reduce confusion should you get fever and a cough, whether it's coronavirus or whether it's influenza. Then we are also cleaning our hands quite frequently. At any place you walk in the hospital, you'll probably see the alcohol hand gel. And again, even the Mwananchi can also use the alcohol hand gel, just buy it from the supermarket, but please make sure that it is more than 70% alcohol. Rub your hands with that alcohol, make sure it lasts at least 20 seconds. We have the capacity to treat the patients in this hospital. Remember that there is no specific treatment for COVID-19. The treatment is predominantly supportive, and most of the time all you need is oxygen. So far, majority of people who would actually require treatment will be elderly patients and patients who have comorbidities such as diabetes or other diseases that reduce your immunity. Majority of people can go home. But as you go home, remember that your children are not at risk. There's been no fatality of children under 15 years. So the people who are at risk are your elderly parents and grandparents, not children. So if you're living with elderly parents and grandparents, take more precautions in cleaning surfaces and using alcohol hand rub. So if you're having a cough or a fever, but you have no other symptom, don't even come to the hospital, stay at home. For us to enhance this communication, we have increased information on our website on frequently asked questions on COVID. We are also setting up a hotline which should be functional before the end of this week so that Mwananchi can inquire, especially when they are sick, whether they should come to hospital.
We've intensified our training, and especially for the nursing team, because as you know, they will be at the people at the front in case we get such a patient. So we've done a lot of training, and especially also in the wards which are likely to receive these patients, which is critical care and the med-surg units, where we do have our isolation rooms. So it's providing that training, infection control precautions, and also being supportive. As you know, there is a lot of anxiety, so that's one of the areas that we are addressing, that staff just to make sure they are supported by the administration as well.
The kids are landing today. So in terms of costing, I cannot answer that right away, so I don't know. In terms of testing here first and then testing in the government, I think this is, our testing is a screening test, so we'll be able to check whether you do have the infection or not. If at all we find you're positive, then the confirmatory test will be done in the government facilities. That's the scenario that we have. We expect the tests the initial one that we do here, about 5 hours turnaround. As I said, the test is brand new. We shall not treat or test people because of cost. So I don't know the logistics of it, whether the insurance is going to pay, whether the government is going to pay. I don't think we've worked that out, but at no time will we withhold testing because of money.